Oh, okay. Bringing it back. Faster than a lot.
Yes, I know. So I'm like, that's.
Oh, it's alright.
Yeah. I mean, they pass it, right, like trees. Like, I don't know, emails, you know, like that's the thing, but it's like specifically. That's true.
When we went to the proposed material, we went to read it. They pretty much this waters. And this is very water through there. Able to they had printed out 4 samples. For study and it was it's like reach the more function. Like this move. Yeah. Oh, it's we're like we're also getting started to use yeah, you got to work for all, but it's a bit across there. Like, yeah, that's what I thought I wanted to do. And so that goes up there, just like, that's good. You know, space. None of those strong in their last. It's no trash, but it's very also. Yeah. So they did. Well, that's it, that's so. Cal, in the degree. So, there's sheets here, this case, they actually has to go to all food settings, so that's great. You know, there's. Yeah. Yeah. How about you? Yeah, up there from the roads out, kind of navigating all through there. There's a long journey to college. So. Just cut your needle. Just nobody up there. She's found the house. Because it's all dialed in, so you can come on there, they go. So that's what he said. That's the white paper. Good for her. She finally, she needs to. Knowledge. Yeah. There's really struggling to do this. And she was always building up my house full time. Just to care of the department. She's the right. Sorry, yeah, they submit actual plans. Other guys, you gonna do that? They're opening. No.
And then. Oh, I mean, like, invite to the
State, right?
yes, yeah, I figured as much. Yeah, yeah.
Yeah. You can imagine.
You know, some roundabout.
Figure it out. Yeah.
Yeah.
Yeah, for sure. Yeah.
That's Jordan. Yeah.
It'll be interesting. We're finally making that move.
Thanks.
Yeah. So,
All right, we officially have enough people. Let's go ahead and get started. Let's go around the room real quick. We don't have much time to get through all this, so let's go around real quick for introductions. I'm Chief Probation Officer Jeff Goldman. To my left,
Acting Public Defender Thomas Angel.
Hello, Sharice Jones from Connecting.
Eric Eastburg. Georgia Arano, Chief Fiscal Admin Officer for the Sheriff's Office. Molly Bashkova, Administrative Analyst for the Sheriff's Office.
Dan Brown, Administrator.
Bob Jacobs, Sheriff's Captain. Brian Gruber, Health and Human Services Agency Director.
Rachel Kenyon, CSF, Director of Social Services.
You sure?
Yeah. I
Okay,
think I got that.
awesome, to that.
Yeah.
All right, Jeremy Vance, probation.
The Memorial Project Card.
Olivia Donnelly, Project Heart. Nancy Copy, Probation.
Wallace Shield, probation.
Later with the CEO.
Cinnamon Danielson, Women Work.
Lydia Stewart, the Office. Later Valencia, Probation Administration. I'm sorry.
Oh, I'm Liz Smith Pause.
Jody and David.
Jody Tucker from Probation, Truckee.
Can't hear you, David.
Everybody.
Wes, DSO. Um, so you know, the meeting is being recorded, and so the agenda for today is primarily going through the funding request that we got for the innovation funds. We changed it up a little bit at the last meeting as to how it would roll out. And so to get through all these, I think the best way to do it, unless someone has a better idea, is we'll go through them one by one. If anyone has any questions, if the individual is here, if they're not here representing it, then I guess we can't have our answers, questions answered unless we decide to postpone and, email out the person. So I think everyone was invited to send in proposals. Okay,
Yes.
that's happening.
Jeff, will we vote today? Or is this just?
That's the plan. That's the hope. Yeah. There's some budget pieces that go along with it. To get it started by the July 1st date. I think that's the main reason. That's correct. Looking at you, Angie, for confirmation.
Yeah, I mean, just the faster we can get things approved, the better chance we have of getting it started.
Sorry, that's good here. The other piece of it is, I think with the May revise, the total amount, and I know we had this discussion that it may come in different, and there's the possibility of, tapping into the reserve balance in the main fund. But I think Angie looked at the May revise yesterday, and with the growth funds, it looks like it's going to come in closer to like 180.
Yeah, it looks like with the two current innovation fund contracts that we have out, they look like they're going to, in fact, spend their entire contract. And with the slight reduction in the main revise numbers, they're going to sit probably about $181,800. That's my estimate.
Just about. Just so we know when we're going through these. Any questions, comments, concerns? All right, well, let's get started. So the first one I have in my stack is Crow's Nest out of Truckee. So are there any questions, comments, feedback? This one.
I have a question.
And I don't know if anyone from Crow's Nest is here. I didn't hear anyone.
Are
rather, I received a helpful comment to pass along, or just a question is there otherwise state funding for this initiative?
I mean, I don't know, I can't answer how they're being funded. I did ask Jody. There's Jordan. Are you from Crow's Nest? Is that correct, Jordan?
Jordan is from Crow's Nest.
All right, maybe you can re-ask the question then, Lydia.
Is there otherwise state funding for this project? Such as homeless housing funding?
Jordan, I don't know if you can hear, but that question is directed at Crow's Nest. I don't know if you heard that question.
There it is. Sorry, I don't know what happened. I got logged in and out of my account 500 times. I'm here now. What was the question again in completion?
The question is, are there other funding opportunities for this, such as state funding?
Other opportunities such as state funding specifically for our treatment?
Yes.
Yeah, we are in contract with Medi-Cal Nevada County, as well as we are seeking other sources of funding pretty regularly that are not specific to states funding, but grant funding in other realms.
Are you finding it successful with other routes?
We are finding we're in year 3, so we're getting like the brand recognition and level of trust that was difficult to obtain funding in the first couple of years. And so we're really starting to see that turn a corner now, and we're getting looked at. We're currently in the running for a couple of other larger funding opportunities to help us really streamline a lot of this process that we're doing with our treatment model, as well as offering a Spanish speaking track, which I also mentioned in this application, among other things like improvements of EHR systems and also possible office expansion to run co-occurring or co-operating groups at the same time. So say like we can operate at the same time, and one side of the building is, or one office is running the English speaking, one office is running the Spanish speaking. So that way we're not flip-flopping or needing to do later hours for one and inconveniencing people for that, not offering them that treatment time right before and right after work kind of a thing.
No, thank you.
Then Jordan, are there current capacity issues? Like, is there a waiting list to get into the Crow's Nest?
Not at the moment. No, there are not any current capacity issues. I think we have a total census of about 20, with 5 more slated to come in by the next couple of weeks. I do believe that with our current model, we can serve up to 24 people a day. All those people in our current census are at some different level of care, either from PHP to IOP to outpatient. So either some are in the higher levels of 5 to 6 days a week, some are in the medium level of 3 to 4 days a week, and some are in the lower levels of 1 to 3.
And I know you kind of touched on this, but the sustainability, I mean, I know you talked about other grants and becoming more recognized and stuff like that. You know, if this was a one-time funding, like how would you sustain this program?
You know, it would help us expand into a place and create even more, I think, brand loyalty, brand recognition, brand trust, and also just community trust from a lot of people in a way that there would be a lot more capability to hold on to the proposal of hiring on said KDAC or RADT if we cannot find a KDAC, as well as said secondary licensed therapists pretty easily with the growth of our current census in that direction. You know, we opened a Spanish speaking track and then we become trusted in that area over the next year. And then that becomes pretty easy to move into the other things. I mean, just in our first year alone, we went from 3 to 5 to 5 to 8. You know, we're in year 3 now and we're at a steady 10 and still climbing right now, especially with the addition of the Medi-Cal contracts we have in place. We're also currently in the middle of being able to offer Nevada Medicare people the possibility of coming to our treatment, as well as we're in contact and working through the initial phases of contracting with El Dorado County, which I realize is a long haul, but we're working towards that. So to be transparent, this would help us get through that next gate and then continue the capability for us to keep flowing. And I don't think that it would all of a sudden halt after a year. It would be pretty easy for us to keep that momentum with the way that we are growing internally. And the thing that we know works best is that we've learned by our current initial organic growth is having licensed and professional individuals who can work in this program, work full time, and be here now and for the people who need the care. And we've seen that time and time again with the people who we've hired on full time, and they've stayed with us because A, they want to work in this field, B, that it's really fulfilling, and C, we offer them, if not better, at least competitive levels of pay to any other place in the region.
And then one more question, with the, talking to Jody, it sounds like the majority of your referrals come from like UI court. And so the individuals generally that would be referred to this population would be a little higher risk, higher need. And
Yep.
do you have experience working with those folks?
I mean, I am one of those folks, quite literally. That's how I started this. I come from that side. I was a person with addiction. I have 4 DUIs on my record. A lot of other crap that I've done. I relate very well with these people, just as in my own track, as well as the people in our track. Our clinical director, I'm stammering because I'm nervous, apologies, but our clinical director, she has 30 years sobriety. Our CFO has a little under 4 or 5 years of sobriety. Our clinic manager has a little over 5 years of sobriety. She comes from an inpatient actually, and started working for us because we were able to offer her the capability for advancement in her career where the inpatient would not. So we're supporting her in her schooling to then become a licensed practitioner outside of just a KDAC herself. So quite literally, like this treatment model and the way that we've developed is we kind of like, we hire like-minded or very compassionate people who either are from the side of addiction or at least adjacent to it, where they have a loved one or a family member. One of our top people who will be an LPCC by the fall, he runs his own recovery track. We're interviewing 2 people right now. One's totally sober. One has a significant other who's sober. So the understanding that we have just within our staff, in my opinion, is second to none for the area.
Is there a possibility that these services would be available if Process were not to receive the full funding requested? Is there a portion of this that would allow you to move forward effectively?
Oh yeah, 100%. I was nervous to ask for the whole amount because I know sometimes you have to ask for less, being brand new and everything. But shoot for the stars, land at the moon, maybe. We can 100% take what is given to us and work with it, no problem. And I'll make sure that whatever funding is dedicated to whatever we talk about happens and we progress in that manner. To be totally transparent, if it were lesser funding, I would focus more on the Spanish speaking track than I would be hiring another licensed clinician of like a higher, more like, acronomical master's level, rather more of like a KDAC style thing.
And just to add to that too, because I know juveniles were included in there, and generally this funding is specific to adults and not juveniles. So
yep,
take that part out.
Okay. Yeah. Sorry, somebody mentioned to me that I should add into it, like, oh, add this in. And I was like, okay.
Yeah, no problem.
Cool.
The innovation fund legislation does cover all of those possibilities, but
Sure. Any questions?
I have a question, it's maybe more for probation and PA potentially, but it's been a long-standing gap, outpatient treatment in the Crescent region. Process has stepped into that and started filling some of that gap, and the goal of serving 25 new people through this program. I'm just curious in terms of capacity, whether we feel like that there's that much additional need. for the justice involved population that this starts not a problem.
That's a good question, and I really don't know.
Jody.
I'm not sure that I completely could hear, Ryan, were you saying, is there a need to serve more than 24 people in this community? It's hard to hear you at that end.
25 additional slots in addition to what Crow's Nest is already serving and other service providers. Do we feel like there's that much additional need in the justice involved population that would be mandated to treatment, which is my understanding of what this is targeting?
Well, I can try to talk to that. We have recently started a DUI court back here in Truckee, and all of our participants are now going to be referred to Crow's Nest starting last month. So, as you know, in Truckee, we tend to be the DUI capital of this county. So, I for sure would predict that there is a greater need for capacity to serve those types of clients. We've gone away from the DUI court up here for quite a while, but when we had it in Truckee initially, it was pretty robust. So in just looking at DUI court participants, I would say that there's a capacity need. And anytime we haven't had great resources up here for any type of outpatient treatment. So we would refer our adult clients out to Crow's Nest as well. We haven't had the local people to refer that to. So I personally, yes, from our caseload perspective, we would be utilizing Crow's Nest. I don't know if that answered your question, but.
Yeah, just want to make sure we're not going to be like over capacity.
And you'll have 25 defendants coming through with those needs in the next year. To refer to,
Non-current.
in addition to who you have now.
Well, it's hard to predict crime, but would I like to not have that many people coming through? Yes, but I do feel as though that's not an outrageous number to expect.
Any other questions for Jordan?
No questions, just a clarification. Are we going to save on generalized comments for right before we start voting?
Are you talking about like more specifically of like logistics of things or?
No, just
How much, make it easier to discuss.
just making our points prior to voting. Is now the appropriate time to do that, or do you want to hear from everybody and then we do that?
Let's hear from everyone first, I think. All right, thank you, Jordan.
Yeah. Do I hang up here? Sorry, I didn't fully understand.
Yeah, you can hang out.
All right. Thank you. Sorry about that.
Yeah, no problem. Next one I have is Reentry Workforce and Benefits Stability Program Connecting Point. Is that? Oh, that's it. Jody called Jordan back.
Well, he was just in here. I think he may have heard you said you could hang out.
No, I said
to
hang out.
Yeah. Do you want him back?
No, I don't think so unless.
Okay.
The appeals.
Yeah. All right, Connecting Point. Anyone have any questions for Connecting Point? Yeah, do I have to start each one? Or can someone else ask a question first?
Like a little summary.
Well, they put a 2-sentence summary at the beginning. Funding is requested to support a structured reentry workforce development program for justice-involved individuals impacted by upcoming ABA, WD, CalFresh participation requirements. The program will provide workforce training, job readiness support, volunteer and internship opportunities, and coordinated reentry support designed to increase long-term employability, stability, and independence. So the few questions I had is, and I don't know a whole lot about the requirements, I mean, other than sitting in some health and human services meetings. Does the skill training itself meet any of those requirements? Or,
From our contact with Kristen Plant, then yes, that would.
so it's not like the skill training, then they have to be in an internship and a job and or a job to meet those requirements. The training itself is.
The training would meet it while they're in the training.
Okay.
And then when that ends, then they would hopefully go into an internship so that it could be sustainable. So they can.
And then the other question I had is, I mean, it's kind of similar like some of the questions we asked before. Are there other entities like Alliance for Workforce Development or other folks that are doing some of this work already or no? Maybe that's a rhetorical question.
So Alliance for Workforce Development is still like, they are absolutely continuing to do employment and training activities with anybody who comes in. But specific to the population of able-bodied adults without dependents, there's nobody in that specific space. And that comes also with some reporting requirements in order to keep people enrolled in CalFresh and Medi-Cal benefits. And Connecting Point would be doing those reporting, would be taking on those reporting requirements as well.
And I think in here you said, so maybe, I mean, probably read it, but there's an estimate that 2,539 local individuals we were required to meet these requirements to maintain benefits. And that's still the current estimate.
That's not just the justice.
That's not just, that's
No, that's the
So we're-
total population.
that's the total population. And we are saying that we could serve at least 120, possibly more, but that's our base target for how many we would be helping with job training and making sure they're meeting hours to qualify for their.
But just so for clarification for people that don't know, I'm not the best person to speak to this. The understanding is people don't meet these requirements, they're at risk of losing their benefits.
Correct.
Which puts them at risk for not being able to access a lot of services that are in this sort of broader system of medical eligibility. It's what gets spent on behavioral health services, if you have substance use or severe mental illness, it makes you eligible for CalAID. So like as a piece of the bigger puzzle, keeping people enrolled is really important. I'm curious if this is added versus the services that will be available to non-justice involved populations.
It would be additive. It would be more, so we would be able to provide the hours that are needed for them to keep their benefits. The other programs that we have, they create opportunities with outside agencies, and whether they meet those or not, with that outside agency is really up to them. We're just doing the reporting piece between the nonprofit and the person, the able-bodied person. But this, we're proposing like a more structured approach so that we could provide those hours at our facility through job readiness and training. Soft skills, and then also like networking and.
Is any of this included in like the ECM? Like, are any of these activities, would they be included in like the ECM?
Right now, no.
Yeah.
Right now, we're just we're launching the ECM program as well. In the next couple of weeks, we should be getting referrals and doing like a run through of that. And that funding is through December, so we have until then to really. That's what our plan is for like prolonging or like sustainability. But right now. Do you clarify that you have funding through December, or you have funding starting in December? We have funding through December to pay for a staff person to get our ECM program up and running so that it's Medi-Cal, it'd be able to be billed through Medi-Cal, so it's sustainable beyond December. Right now, though, these requirements start in July, and so we are hoping that we can develop this bridge program between our volunteer hub, our employment services, and ECM to really provide services to folks who could be losing their benefits, with the hope that this is sustainable through future Medi-Cal funding. But that's not possible until after December.
I have a question, as for process, is this program feasible with not the full amount that's requested here?
Sure, with reducing the amount of individuals served. And our hope, all of our programs, we aim to serve a certain amount. Typically, we blow past that. So it's a conservative amount of referrals that we're accepting. But yeah, there's feeling.
Folks in Eastern County.
We would love to. Our other job training program right now is available to people in Eastern County. We do partner with Alliance for a location and also the library. And then we have Chromebooks that we make available and we try to meet with them virtually, but also in person.
Sounds like you're trying to capture a broad segment of people that are in reentry. Is there some sort of requirement, or is just as long as you're booked in Nevada County Jail, that means that you, so someone like it's arrested on DUI or some low level misdemeanor, that would still qualify as reentry, is that right?
I believe so. And yes, it would. But also there's the dual eligibility of receiving benefits, which Medi-Cal, food stamps, sorry, and also being eligible for our ECM program. So it would be that population we're capturing. So yeah.
Other questions? Thank you. I won't say anything else. Right, women in work is the next one. I'll open it to other questions first. I think the same, I mean, they're all in kind of a similar vein, like, just ask all three of these at the same time. Like, is there a gap in services right now that we're trying to fill? Have we identified a need? Kind of like we talked with everyone so far, like, have we identified what that need looks like? The sustainability considered.
Thank you. So as you probably already know, Women at Work has a safe house that we run here in Nevada County. We've been in Nevada County for 25 years. So there are lots of needs that we are not able to meet in the county because they don't typically qualify for our safe house. There is a need for transitional housing. And so we are opening a transitional house that will be for a different population of women and children that may specifically be women who are experiencing homelessness, but maybe wouldn't qualify for our safe house, or women who have are leaving some sort of incarceration and need reentry housing. And so the transitional house would give them the ability to live as long as they were recovering and finding skills and getting permanent housing. And we would offer, like we do in our safe house, we would offer the ability for them to be drug tested, which we do now. We'd also make sure that they had access to counseling support services. The other pieces that we do now, which is social work by our social worker and case management, and then housing support. So it would be very similar to what we have now in a safe house, but it would just make it easier for us to be able to offer housing of people who don't qualify for our safe house. It's also been tricky if probation has come to our safe house because someone's on probation. That's challenging for the rest of our safe house. And so this is just an easier way for people who are in reentry to be able to have housing, but also support services while they're in housing.
Any other questions?
I didn't answer that. I'm so sorry. I did not answer. Is it sustainable? So we're going to open it regardless. And so obviously the more help we can get from community partners is going to make it a little easier on us. Either way, we are committed to pay for it. But boy, it would be really helpful to have some help with that. And that being said, we do have the ability to offer, I don't know what the needs for probation for reentry for women is, but we certainly could have 1 or 2 rooms in that transitional house that is just for probation to use for people who are reentering from jails or wherever it is that they need housing. So those could belong to you if that is more comfortable
I just don't know what your need is to speak to. Do you even have a need for that? And so sustainability, we will definitely be able to pay for it regardless. We would just love some help.
Yeah, I mean, I wouldn't be the best person to answer that question, but generally, we don't usually lock off bids because, you know, someone else has that need, if we don't need it right then, we'd rather someone else be in that bid, I would think, but.
Seems like there is a need though. Probationers.
Is the criteria, do they have to have a past history of victimization of domestic violence? Great question, because obviously that is our mission. And so really, we are hoping this prevents domestic violence and trafficking. If women are on the street or don't have good support services, they end up being trafficked or experiencing violence on the street. So really, it's our prevention wing. We're just trying to prevent women from having violence against them and to prevent them from experiencing domestic violence because they go to a home that isn't safe, or they're trafficked because they don't have any other options. So it's really our prevention wing that we're doing this. And they do not need domestic violence in their background to qualify for a transitional house. We're just trying to prevent these kinds of things from happening to women. And they can come in with their children and stay up to a year.
I was just going to ask the other funding sources that you're looking at, it will limit the criteria to victims.
No, it'll be our own private funding and it does not limit our criteria. And our only limit now is just our safe house, and it's limited by our own mission. And so we're trying to move into a transitional house so that we aren't limited by that. We get so many calls we have to turn away. And that obviously we don't want to do that. We want women to have housing, we want them to be safe.
So I think you sort of spoke to my question, but you mentioned if they don't qualify for the safe house, they may be able to be here, and if that allows domestic violence, that history would be one of those.
Doesn't matter what their history is, if they are in need of support services while they need transitional housing, that would be enough to qualify. And so right now we turn people away who don't have domestic violence or trafficking. We never want to do that again. So it just opens us up to be able to provide housing and a therapeutic setting for people to heal who've been on the street or maybe who've been incarcerated, a place where they can go to as they're getting job training or their next level home, housing support for permanent housing, all of those things we want to see happen. We just don't want women on the street unsafe.
Yeah, questions?
Sustainability question, same question from the last minute, like, funding, what would you do?
Either way, we're opening it. We would love to have some support for it, but either way, we're funding it.
Any other questions? Next one is Project Heart. Yes. Same questions. I mean, the need. Just put it out there on the need. I know that you put the 40, 1170s. I mean, that's today we have 12. So there, I mean, that's just different. Same sustainability question, and also on this one I had like physical space question, like where would it be? Like where are you thinking that it would be, and like the transportation issues around that.
So Project HARP obviously has been serving adult reentry services since 2019. We received 4 cohorts of the Florida State Community Corrections Grant. Currently in our fourth cohort, those grants are specific to adult reentry services to those who have state prison CDCR numbers. And so as time has gone, we've identified that the 1170H population or mandatory supervision have very similar criminogenic needs, sometimes even greater than those that have been to state prison, but they don't have the ability, we don't have the ability to serve them because it's not part of the grant. And so our goal is to create a day reporting center to fill the gap specifically for that population because of their extreme needs and the adult the reentry component to their services. It is a case management model day reporting center that ultimately will provide daily programming for these folks. I don't know, we threw 40 out there because didn't know the actual numbers. So to kind of give you an idea about some success from our previous adult reentry programs, we served 47 people last grant. 25 were successful. Of those 25, one person was arrested for a new law offense. So, and you have to have a new law offense in order to have recidivism. So that's a pretty good stat, like 0.04% of successful people. 10 of the 47 were rearrested for a new law offense, whether they were of the 25, so there's 22 people who were unsuccessful. So the model works. The model works to fill gaps. The day reporting center would be in the hub of the Brunswick Basin area. We have an office right next door to Humpty Dumpty's. There is an office next door that we are occupying effective July 1st. So it will have its own system, its own setup, workstations, staffing, and then again with evidence-based programming, daily evidence-based programming. The sustainability model, we're actually already serving these folks, but we're serving them out of the kindness of our heart based on the fact that there's no funding stream. So we are doing the best that we can with this population. Unfortunately, they're not getting nearly as intensive services as they need that we've identified with the population that was within our New Start program, which is also our CDCR population. So I think I answered that question.
If I could, I was just saying, I wanted to touch on the transportation piece. In our local evaluation report for cohort 3, one of the immediate needs that was identified upon people being released from, well, prison, but in this case, it would be jail. Transportation was an immediate need, and so we really prioritize. We have 4 company vehicles now. We anticipate to have more in the future, but essentially each case manager has a company vehicle on site where they can take clients to and from these appointments. We take people to behavioral health all the time. We take people to their probation appointments when needed. We take them to court. So it would just be added on to that, and we would make sure that they could get to and from their day reporting.
I think the important part about that is Project Heart's already embedded in the criminal justice system. We have an in-reach program at the jail, so we're making contact with these folks pre-release. We're understanding their needs. We have a long-standing relationship with the DA, the public defender, the probation department, that ultimately we can capture these folks early and make sure that they don't slip through the cracks. Because oftentimes warm handoffs aren't so warm. And so that our goal is to use our embedded system with the criminal justice system to make sure that these folks are served correctly.
Any other questions?
Jim, how are you guys identifying the 1170 folks?
Well,
Is it like self-report, they tell you that they are, or?
kind of a combination. I think that term 1170 is more used amongst like criminal justice folk, not the folks that are the clients that we serve. So we ask them, what kind of probation are you on? They'll say probation. So we reach out to the normal probation officers. Hey, what status are they on? Some of them are a little more savvy. We are in court a lot, so we listen to the sentencing. And so we're our case managers are familiar with the lingo that's being used in the court system to determine whether or not they're 1170H cases as well.
We wrote this, I believe we wrote this into the grant, but we would love to work with the probation officer that's assigned to the client, and we can work with them on their terms and conditions to ensure that they're 1, complying, and 2, being set up for success. Self-reporting
by the client often can be, as we all know, inaccurate. So we generally verify that with our other community partners.
Similar question asked to others, if the full project award isn't available for this effort, can you do something in this space with a lesser amount?
Yes.
What might that look like?
Well, we would reduce staffing. The grant was written under the guise that there was potentially 40 people on 1170H. So 12 people is a little bit less significant. We would just scale back some of the staffing costs. We would separate out rent costs, utility costs, and then work on, the programming won't change, just the operational component of of the day reporting center will change, but the programming would remain the same. Because we're offering many of these programs already.
And is there a separate space needed for this program, or is it something that you have some space that might function for it? We're honestly exploding out of the office that we have with the amount of clients, so the extra space is definitely necessary. In my opinion.
We have about 700 touches a month. We about 700 touches a month. So yeah, our office space is a little small. So we're planning on expanding to it right next door. This program would help pay for the rent cost for that. But we're still moving into that space regardless. I think the one component that I didn't mention that I think is really important is that we want to implement a restorative justice program. And the goal of that would be to have a trained restorative justice facilitator to bring along that component of the community healing based on the victimization of folks in the community. So I think that's really important component as well.
In terms of the services provided on site, provided by Project Heart staff to get into transport people to like behavioral health and other service providers.
Yes, we have trained facilitators in numerous evidence-based programming. So the internal capacity is already built.
Find that the folks you're working with, are there a lot of unhoused homes in that population, or is it generally housed people? And how's the location in terms of accessibility for your public?
Accessibility hasn't been an issue. I mean, we're centrally located to, the many other service providers that serve. I would say we're 50-50 when it comes to housing. What we have recognized is that the community supports program through CalAIM and the transitional rent program, I think, is rolling out much slower than anticipated. Also being reserved for the especially mentally ill. And so these folks are more in the low to moderate system when it comes to an assessment through adult behavioral health. And so they don't have access to transitional rent as maybe someone else might. And so our goal would also be to use some of this money to help with housing deposits if they don't have Medi-Cal through the community support program and or transitional housing to keep them on their feet. The Housing First initiative is really the component of which I believe our program is most successful. I'm trying to find housing first.
Well, it's difficult too, because our clientele, a lot of them are unhoused due to energetic risk factors or their background. They won't pass background check to live in an apartment, things like that. Where the transitional rent services currently are more for the SMI population. And so we still have that need of, they need transitional rent assistance, but they don't fall under any qualifying programs currently. So that's the gap that we're trying to fill.
Just in terms of partnership, you have the homeless state resource center, down something where there's already behavioral health services on site, there's already a medical or social services. So I don't know if that would be
Absolutely.
an alternative location or just a potential partnership.
I said, so I feel like the thing that sets Project Heart apart from any other organization is the peer-led case management with folks that have real life experience, understanding what it's like to live coming out of jail and or prison, and the barriers that come with that. And I think that's what sets. I think that's what we do best. And so, and we have proven success.
Or something that's run by it's very peer empowerment center. So
Yeah.
it's also a peer model. So a big partnership.
Yeah, thank you.
Any other questions?
Just the sustainability piece. What about next year? We build this up, what do you do next year?
We write another grant for the CCP Innovation Fund. The goal is to become sustainable through other means, including donations and other contracts and things that we have. Like I said, we are providing light services to this population, so they would still be part of our community. They may just not be as intensive. But the goal would be in the next year to continually to build so that day reporting center is operational regardless. Like I said, we already have the internal capacity to offer the programming. So if we don't have a specific office, we have an office already that we can offer the program because the internal capacity is already there. So this grant will allow us to really create a program with internal capacity to sustain long term.
Any other questions? All right, thank you. Two more, you're up next, Liz. So next is Fox. Any questions for Liz? All right. The only other question, I guess, the only one, sustainability question. And then last year you said serve 10 people, is that right?
Yes, so, so our goal for last year was to help 5 people. And, we're now at 11. We fostered 15 animals. And, we've reunified 7 individuals with their pets. We had no idea how, needed this program was gonna be. We, like, let me see. Yeah, so originally our goal was to help 5 people. I'm nervous. We've already helped 12 clients access treatment, recovery, or stabilization services. Between just November of 2025 and February of this year, we've received 34 phone calls of services needed. And because our funding has become, we're running low on funding, we've had to scale back and prioritize emergency cases only. But yeah, this is a great program. As far as sustainability, we are actively pursuing additional grant opportunities and community funding sources that align with our mission. There's currently a growing statewide initiative focused on keeping animals out of shelters and supporting community-based animal welfare programs, and we are pursuing multiple funding opportunities connected with that effort.
Are those reunified folks? I mean, I think since have been reunified.
And then we still have a few that we're serving right now.
So are those people that successfully completed treatment or whatever they
Yeah.
were doing? And is that 7 out of the 10 or is that, okay, so 3 were not successful, so.
Oh, no, we still have some clients. There were 2 unsuccessful.
Okay.
But I would say, you know, I think it was, let's see, we've had 12 clients. I'm sorry. When I wrote that, we had 10, now we have 12.
Okay.
But 2 out of 12 clients didn't finish the program. So I think that's pretty good.
When they don't finish the program, do they get the animals back?
It depends on the situation. So in both of those situations, they voluntarily said, I cannot keep my animal. One of them found out that they were going to go to jail for a very long time. And the other situation, he left the state to go stay with family members.
I love the concept of the program. If they've bargained with their pet and their pet being safe is some of the barrier to going into treatment. I think that adds a lot of value. I'll be honest that some of the feedback that I received was that there were situations where people weren't necessarily aware that if they failed treatment, they might not get that pet back. So I'm just curious in terms of whatever agreements you come up with participants, if they're like, I don't want an animal to return to an unsafe situation, but I also don't want people who that's their one companion and they fail treatment, which is a frequent occurrence.
Yeah.
That they're upfront and know.
So the goal of this program is to make sure that people have their animals when they get out of treatment or whatever program, because we actually ended up expanding our services a little bit in the beginning. We had a lot of our elderly community members who needed emergency surgeries, or we had a woman who was entering Women of Worth, and we took 2 of her cats. But if it comes to them not completing their program, we work very hard to figure out a way to make that happen. We don't want their animal. It's financially drains us, and it's hard for us to find permanent placement for them. And the whole point of this program is to make sure that people have their companions. There was one situation where we were kind of put in a difficult place. We knew that she was using substances in her home, smoking them with her animal, and she wanted her animal back. We had to work with behavioral health and figure out a solution to that. I don't think anybody left that feeling good or happy about it, but we did come to a solution. Typically, we do have to prioritize the safety of both our client and him.
Any questions?
Yeah, sorry, I'm getting a little confused. So would this funding be strictly put towards justice involved? Because the proposal talks about how you get service low income, unhoused, and justice involved. So
Yeah,
just mentioned folks that were in the other two categories. So is this funding specifically to be targeted to those that are justice involved?
I think what we're doing is prevention. We grab them before they become justice involved, and that's where we, our recidivism program. So by keeping them out of justice involved situations, that's how we're helping. We help them get into, rehabs or recovery or, whatever they need. I don't know. Because like I said, we do help elderly as well. We help anyone who needs to go into rehab and recover. So if they don't go into the hospital and get the emergency surgery they need, will they end up in prison? I don't know. But majority of our clients are people who are either going into rehab or living up work or situations like that.
How long is the typical fostering, or how long can it be? And then say that somebody needs to enter a transitional home that does not take pets. Do they have visitation rights or opportunities so that they can stay longer term, but still have that relationship with their pet?
Yeah, actually, a lot of our clients do go to transitional living situations. So typically, I think it's usually around anywhere from 3 to 9 months is our usual. But we do it up to I think it's 18 months to 2 years, because we do recognize that transitional living situations are a factor. You get out of rehab and you still don't have somewhere to go. So, and then we do set up visits, and we set them up while they're in rehab and while they're in transitional living. We keep in constant communication in situations. We've had quite a few cats, actually. We were surprised how many cats we got in. In those situations, it's a little bit harder to do visitations. But what we do is we send pictures and updates weekly or bi-weekly.
The last one.
Really quick,
Oh, sure.
sorry. One of the things that we're mainly focused on with this funding this time around is that we found that something that's draining us is the emergency kennel services. Right after this meeting, I'm actually going to go meet with a client who has 24 hours to place her dog, and she is currently a patient at Lovett. We have found that many of our calls involve urgent situations. So someone who is going into rehab and they have 24-hour notice, someone who needs emergency surgery, someone who loses temporary housing for their pets while they're in treatment. So one of the things that we're asking for with this funding is to create our own kenneling. It's a, sorry, I wrote this down because I'm so nervous. It's basically holding kennels. It's a safe, supervised temporary housing with outdoor runs, enrichment, exercise, proper care for dogs and cats until we can get them permanent placement, because we are in situations where we only have 24-hour notice. We can't safely place them into a foster home because they have to have behavioral assessments and health assessments before we can do that. And so by having these kennels, we can move on emergency situations and place them somewhere safe, and the person can go get their emergency treatment. So yeah.
Thank you. All right, the last one is the Veteran Services Office. David, Anyone have any questions for David on this proposal? I know we talked about it. This was slightly different, I think, than the one you did.
So this is actually my first time actually submitting the actual for the formal grant process for this position. Currently there is a hole in services available or options available for veterans that become incarcerated or enter the legal process. And what I'm asking for is funding to fund a position that will be able to work both directly with the DA's office and public defender's office to provide veterans diversion and eventually treatment court to veterans that enter the justice system.
Any questions? Okay.
Sorry.
As we get the numbers up and running for veterans diversion, now that felonies are allowed, and as we work on developing the treatment plans, is there a
Yes.
possibility of having a part-time specialist on staff instead of the full-time? Or
Yes,
using somebody
yes,
that we
I
already
would.
have?
Well, we don't have anybody on staff at the moment, right? And as the need grows, there is going to be a need for heavy training. But as we grow this program, I would be more than willing to bring on a part-time employee as the need grows. Because right now we don't have any data available on any format.
I will just say that there is a challenge, like, it's hard to hire part-time employees, right? I get really
Yes.
hard to hire part-time employees who then want to go to full-time. So it would probably be some, like, there could very easily be turnover, like we get somebody really trained who only wants to work part-time. And then as the need grows, that person doesn't want to stay. So anyway, I'll just highlight that it's hard.
Yeah, I'm willing, yes, I would be willing to accept, but it would there would be a potential that it would be a revolving door, because people would want to get a full-time position working at the office, right? That's the nature of the beast with part-time work. I don't want to clarify that for Rachel.
Just as challenging as it is to hire a part-time employee versus a full-time, this is considered one-time funding. So I would hazard a guess that this is going to be a limited term position. We've also seen struggles with hiring limited term.
Yes, so
Question?
it would start off as a limited term. With right now, we're limited in our abilities to apply for other grants because of the complete lack of data to support the need, right? So we know that we have over 100 veterans the past 3 years entering into the legal system. However, we don't know any more beyond that. If they're applying for diversion, if they're ready for diversion. So there is opportunities for continued funding. We just don't have the data to support those at the moment. So the idea behind this position is to start a program and start collecting this data, so therefore that we can apply for those other funding sources.
Questions I have are questions that normally I would know from something coming from within my agency, but I purposely have not been asking about this because it was coming here. So even a limited term position requires that we go through the request for staffing change process and get approval from the CEO and then the board of supervisors. My understanding is that probably has not occurred yet. So we would still have to go through that. That would occur in October. We wouldn't know probably until December. So that's the challenge. And I think it does speak to the temporary, even though I recognize the challenges with hiring. It would be a smoother path to approval and would allow you to start collecting some of that data versus something that essentially even flooded.
Yes. Sorry, I'm having a hard time hearing some of the questions, but yes, Ryan.
Any other questions?
Comment that for long-term, we would certainly be willing to partner in a grant request. I think that there was BJA funding for the Veterans Treatment Court program that we just was down on, but in future years, we would certainly be willing to join in the grant. PA's office
Yes.
and PD's office, I'm sure.
Yes, that's correct. Yes, yes.
And for some of this data, like, this is probably a Paul question, but in the pre-sentence investigation part of the work that we do, is we used to ask them, do you have any military service? Not that we dig deep into it as to what it is or any of that kind of stuff, but we would be able to hopefully extract some of that information. Certain things.
Yeah, I guess fair to ask, can I get a rate if they have? It's just advice.
I mean, in the rules of court, it used to be a part of the pre-sentence investigation.
Of the investigation.
There's a checkbox. I looked it up the other day. I'm just saying, like, there's some data, I don't know how accurate
Yeah.
it is, but at least if someone identifies that they want to share that information, it should be in there.
The data, okay. I think it's actually just advice. A special program.
Is the judicial council? The MIL.
Maybe you,
Yeah.
Yeah, I can't, I'm hearing like one, I'm hearing like every third word, so I'm trying to put it all together.
okay. We're just getting a lot of feedback. All right, any other questions for David? All right, so it is 12:03. So, I mean, I'll leave it up to the crew, but we have a couple options. I know that you said you had some just simple questions too, I think, right?
But it's probably just more comments based on.
Okay, so, I mean, I don't want to rush.
Yeah.
Rush the process. I mean, I know people have other places to be, and I think we always undershoot on the time on this stuff. Maybe that's,
Can I just make a motion that we take the information that we heard today and we go back and we caucus this with our individual departments? We didn't get a lot of time to review these proposals ahead of time. They came in on Tuesday. So I feel like the amount of funding here is not insignificant, and these are all great causes. So I think we need to take some more time to digest this and really evaluate the true need. Did their proposals hit what the ask was? Because I think several of them don't. But I think we need time to kind of consolidate those thoughts and then come back.
yeah, and that's fine. The only thing I would say is just a reminder from the logistics of it. I think last time we talked about, because before it was a $240,000 grants, then we had that discussion about the 200,000 and how that fits and like the flexibility within that. So I think that's the other piece of it of, you know, as Angie said, I mean, if we go over 181.8, then that account is zero. And so we just have to know that, and we know that that account doesn't build at a very fast rate because it's just that little piece of the funding that goes in there. And we also had discussions about like how this looks long-term and discussing like maybe in July or sometime having like a budget workshop or CCP specific to kind of go over those things, but obviously we don't have that time right now. But just to keep those things in mind when we're going through that, it's kind of a, I guess nothing's off the table relative to the max to the minimum kind of with those proposals. So
I second the motion.
I guess, sorry, we have a motion on the floor. Any discussion? All those in favor, say aye. 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 We pick a date right now. So
I'll second that.
so that we have this locked in.
We make it at 10:30, so.
Yeah.
Just looked at.
We wanna. Push it out 2 weeks, next week or
That would be June 4th. June 4th.
I have to skip my Cali training, but I think I can do that. That works for me. Does that work for everybody?
What's rough? Something pretty big on that day.
Huh?
Something pretty big on that day.
I know.
It's not approved.
It's like, look at for certain, it's perfect.
Right. Thank you.
He's gonna miss his training all at the same time. Better bring cake. Right. I was gonna find somebody who can't. Yes. Yes.